Hello and welcome to the Dizziness and Balance video series by the Ear and Balance Institute. I am your host, Dr. Gerard Gianoli, and I am a board-certified neuro-otologist. Neuro-otology is the medical specialty that deals with inner ear dizziness and balance disorders. This video series is intended to be educational and not intended to be medical advice. For individual medical advice, please speak with your own physician. In this video, I'm going to talk about the anatomy of the ear. You can divide the ear into three sections. There's the external ear, the middle ear, and the inner ear. The external ear includes the pinna, which is the thing that hangs off the side of your head, and the ear canal, all the way up to the eardrum. As sound goes in through the ear canal, it bounces off of the eardrum, and the eardrum will move the hearing bones, or the ossicles, that's in the middle ear. The middle ear is filled with air, and if you ever hear about little children that have fluid in their ears, that's the area we're talking about. So when someone gets an ear infection, that's usually the spot we're talking about. As the sound vibrates through the ear bones, the last ear bone, or the stapes, will vibrate up and down like a little piston, sending sound vibrations into the inner ear. The inner ear is encased in very dense bone. It's actually the most dense bone in the body, and it's got this maze of canals that are filled with fluid, and they're supposed to have fluid. As a matter of fact, it's often called the labyrinth because there's so many different canals involved. The vibrations from the last ear bone will go through the fluid and travel all the way up through the hearing canal, which we call the cochlea. In there, it's going to stimulate some hair cells, which will stimulate the hearing nerve or auditory nerve. The auditory nerve then transmits signals up through the brainstem up to the auditory cortex where we perceive sound. Also attached to the hearing canal or cochlea is the vestibular or balance portion of the inner ear. That includes 5 different sensors on each side for balance. There's the 3 semicircular canals, which are in fact semicircular canals. What stimulates those are rotational movements of the head, like saying no or yes, will stimulate those sensors. There's also sensors for detecting gravity. Those are called the otolithic organs, the utricle and the saccule. Unlike the semicircular canals, they're also affected by gravity because there's these calcium carbonate crystals on top of the sensor, such that if you just tilt your head a little bit off to one side, you will feel, or your body will sense, that gravity has shifted over. So it's your kind of internal plumb line, if you would. So abnormal stimulation of these structures will provoke reflexes that can give us the symptoms of inner ear disorders. Because the balance sensors are located in this bony space that's connected to the hearing canal, often patients with inner ear balance disorders will also have symptoms related to hearing, such as hearing loss and tinnitus. For more information on the balance reflexes and associated symptoms, please check out our video, Vestibular Reflexes and Symptoms.